How are you
Hi,
doing?
I'm
Good.
fine, and you, Prof?
Good.
How's it going?
Good to see you.
How are things going at the government clinics at the moment?
I think stressful, but they seem to be going well. I think our systems are getting there. I think for me what's important is that I saw a lovely lady yesterday, teaches grade 1, and she said how well the grade 1s understand their magic bubble. Okay. So I still don't see social distancing, and I think that's so important. And obviously we're talking now so we don't have masks on, but proper wearing of masks covering nose and face and not touching your face all the time. So again, we're going to say to people, if you are coming for routine follow-ups, postpone it for a month or two like we all do. If you require scripts, I think you guys and the navigators are amazing, and we are so grateful that they come out, because a lot of them are, and most of them are people who've had cancer. But they come out because they understand if you're not on active treatment, you are no more or less or worse than the person next to you. And they come each week to help out. But they've come up with a very nice idea of putting people in rows next to signposting that we had organised last year, so thank you for that. So there'll be a signposting scripts, and then people will sit in that row, again, nicely socially distanced, and one of the navigators will come and collect your ID, and then we'll fill out your scripts, and you can go directly to the pharmacy to get scripts. I don't know if you had any luck with researching whether government patients can get their scripts from Discam.
They can get their scripts anywhere as long as it is on the right paper and documentation.
Okay.
And signed by the doctors.
Okay.
In some cases it might be cheaper going to Discam,
Okay.
depending on the medication.
So as long as
you're on.
I'm writing it on a government script format.
Yes.
Okay. So that's important to know. So we will make sure we have scripts here at Mill Park and at Helen Joseph, so if people want to phone in. Again, remember, this is a temporizing method. It is important still to have your clinical examinations, so scripting, whether you script for a blood pressure, cholesterol, or any medication. It's not just as simple as just you go for repeated scripts because you want to check your cholesterol levels, check your blood pressure. The same thing applies for oncology scripts. So we will run this until it's deemed safe from COVID numbers, or we have vaccines, etc. And then we're going to encourage people to patiently remember to come in for their routine yearly checkups. That's that. So a row for scripts. Obviously people coming for routine, we're going to step them aside and say please come later. What are the other rows we're going to have?
We're going to have a results row, which will be the people that will be going through first.
We've had core biopsies, yes, so they will wait for their results, and the results take 10 days to 2 weeks. And then obviously people from a post-operative point of view, we take 6 weeks, we'll wait. Again, we'll triage people, so we encourage people, if you're wanting breast reductions, etc., not to come in at this stage. And remember, the plastics clinic is not my clinic, it's separate too. We're still doing sensible breast reconstructions in terms of breast saving, and we are triaging everyone for breastless, probably only doing 3 or 4 on a list, just because it takes time around COVID testing and safety for anaesthetists around intubation. Is there anything from a clinic point of view I haven't mentioned?
If you need a script, you can email us at hjhscripts@mybreast.org.za, and we can send you an electronic script which you can print and take to the pharmacy. They will accept it currently, depending on the schedule of the drugs.
All right. So I've also asked from a radiology point of view, the radiology department, for them to turn away people who are for routine, because in small enclosed areas, particularly going into mammogram machines and sonars, ultrasounds, you are putting the radiologists, the radiographers, and yourself at higher risk. So we really ask just for sensible understanding at this time. Please stand back from the administrative staff at the clinic, because again, they are seeing lots of patients, and if they're not available and my clerks aren't available to work, I technically can't run a clinic. I had a WhatsApp today by a gynae in private, a good friend of mine, about someone metastatic breast cancer, about not being able to access services. Remember, Helen Joseph is about newly diagnosed and surgery, routine follow-up. We don't offer radiation or chemotherapy at Helen Joseph. I'd love it if we could, but we don't, and that is done at CMJ, and you need to pressurize and organize that you are getting your treatment. Understand that too will have logistic issues that they will need to deal with, so we have to just be patient.
I think the reality at the moment is whether it's government or private.
Yeah.
If you don't need to go, stay at home.
Yeah.
It's so bad that I'm now ordering office supplies online. It's quite addictive.
That's excellent. I think
So
I
we
should
don't-
get into online shopping.
So we don't have to do anything
Absolutely.
putting ourselves at risk
Absolutely.
in the general population shops.
Absolutely. Absolutely. I think if you can shop online, try and do everything as sensible as possible. What I consider people who are at higher risk should definitely make sure that they self-isolate as best as possible. So I've done that with Dom, and I've worked out who is driving around and fetching and carrying and everything. I think that's important. Is there anything else that you think we should talk about? We're going to run a series of going through all the Buddies articles on breast pain, newly diagnosed, nipple discharge, different types of breast cancer. We'll show the handouts, how they can access them through Breast Health Foundation website, and also then I think Jenna will put it out as a YouTube so that people can comment on it. So we're just making sure that we learning from this changed environment and maybe offering more online information to make people feel less threatened and more safe.
I think something else to just bear in mind is a lot of our patients who are currently on treatment are isolating,
Yeah,
and depression is becoming a real issue.
very important.
That we access care for those
Very
who
important.
are being isolated.
Very, very important. I think that is hugely important. Concept of giving forward. So I mean, we were speaking about it earlier. I'm here in my running pants and my scrub top, and you'd asked me. I've just done 2 training in a row. I mean, partly because it keeps my head sane. So we need to look at ways, and each person will have different coping methods. There's not a perfect person on the planet. I think people will turn a lot to crutches that they need at this time, to be aware of the concept of giving forward, maybe a phone call, maybe I've learned how to do a WhatsApp video, which is a whole new thing for me.
Wow.
Okay.
Wow.
So you can talk to people and look at their faces and make sure, whereas if you can't be up close and personal with somebody, just look out for people. Maybe go through your WhatsApp, what's the new thing, Telegram, as people load up on your system. Say, gee, that is a familiar face I haven't spoken to for a while. Let me make contact, obviously respectfully and politely. Some people might not want to, just to make sure that people are safe.
I got some really good advice over the weekend.
Yeah.
Because you've told me to stay at home and work from home,
Yeah.
you get into the syndrome of home and work is the same place and you don't get a break.
Yeah.
So a bit of advice for everybody. If you are working from home, walk out your front door, take a walk around your garden in one direction, come in as though you're going into the office. And when you finish at the end of the day, walk in the opposite direction so that you can close off your work from your home space, because I think a lot of us are dying to get out the house and dying to just go to the clinic for a checkup because we are feeling so isolated.
I love that.
So that's just one way of doing it, and if worse comes to worse, call us, and you can always have a WhatsApp call on video with one of the counsellors just to have that interaction with somebody.
I think so. I think that's so important, and I think what I am absolutely appallingly bad at, and is the concept of separating homework and life balance. I don't have any, and we all know that. But I think it's important, if you can, to just break down aspects of your day. So if you are, and I'm always super grateful, and I've used you guys awfully because I work like I work. So if you're going to say, my phone is off, this is my time for having dinner with family, partner, or just getting into my own headspace, then you must do that. Because otherwise what happens, and I love you walking around the garden, and I think even if you are fortunate enough to have a home with more than one room or something, is to separate out your little areas. This is my work little hut, and this is my do this and that and do things. And maybe even not the concept of just get out of bed and straight into, I mean, there are all those funny things when people are sitting with their underpants or their pajamas.
Their Crocs.
Or their glass of wine and their cup of coffee or whatever. But, you know, there's a lot of humour that's come out of what's happening at the moment. But I think just to change, you know, get up, like you brush your teeth, wash your face, etc., and separate it out, because otherwise everything just morphs.
And I think something that's become quite apparent, and
Yeah.
I know you are on the brunt end of this,
Yeah.
is people are not separating working hours from personal hours.
Yeah.
And there is still an etiquette in the business community that you work from 8 till 5.
Yeah.
If it's urgent and you miss the 5 o'clock deadline, you can't expect it now. And the same thing happens with accessing your healthcare team.
Yeah.
You know, have respect for their time as well, so that you don't send WhatsApps 1 o'clock in the morning.
Boy.
When
3 o'clock. This and that. So I think, Lou, thanks. That's important. So,
very important.
and if it's an emergency, don't send a WhatsApp. You need to go to casualty, or you need to go, because if someone's got their phone on silent, they're not going to pick it up. And I also got another WhatsApp by someone who thought they had COVID. And I was sitting with Charles, and I really hope, I think he's going to do something with Bruce Health Foundation at the end of, and his comment to me was, phone your GP to do an online this. They will tell you where you access the test, what to do, etc. So those are the routines and rules and systems. You're worried you've got a cough and a snot and a this, contact your GP, contact your casualty, they will tell you what to do, okay? If you've got breast pain or you're wanting to know what your results are for something, don't WhatsApp it at 6 o'clock or 8 o'clock or 10 o'clock or 12 o'clock or 2 in the morning. Have a respect, you are so right, and I think that's a nice, I did that whole thing with Ben and Ben Bites. You and I must find one that we must do, me and you. But that's a good thing for this week, okay? Respect for the person next to us, and that is social distancing, mask wearing, and time, how you access them.
We have a standing joke in the office about you, which you might not be aware of yet.
Okay, all right.
But you being the specialist breast surgeon and dealing with breast cancers, if I have a heart attack, I don't want you near me as my doctor.
Absolutely, 100%.
And I think our patients need to understand that
100%.
you are not the COVID knowledgeable doctor. You're aware of it and you can refer.
Or the headache doctor, or the
that's it.
Heart doctor. In fact, where's the heart again? Yeah, okay. So it's that concept.
It's
you're
that concept.
100% right.
You know, if you drive a BMW, you don't go to Mini to have it serviced.
Not at all.
You do. That's a bad example.
Okay.
It's that sort of concept.
Yeah.
So as much as we deal with breast cancers, that is what we deal with. If you have a hematological cancer, I can help you from a emotional support system, but not from a disease perspective. And I think that's very important for our patients to understand, because sometimes they're coming in with a sore arm, which is unrelated to the cancers. It's about just inquiring first before going.
GP, casualty, inquire, respect. And I'm going to see you next Monday. Anything else? Good?
No, I just think at the moment everybody has a cough or a sneeze or the food doesn't taste that great. Everybody's in a mindset, I've got COVID. And I think we need to just be realistic. If we self-isolate, we distance ourselves, keep ourselves safe, we won't get into that anxiety state of, I've got COVID.
Good.
Thanks, Carol.
Next Monday. Looking forward.
Next Monday.
Thanks, Jenna.